as a lot of you know, currently the first draft of the state report on the UN Convention on the Rights of Persons with Disabilities is out for consultation. So we're just going to talk a bit about that process. There's myself and Julia Ahern will be joining us from Children's Rights Alliance, and she'll be talking about their experience of working with the state report on the Children's Rights Convention, so that we can learn from their experience kind of what to expect of the process and what's happened in the past. We are recording this webinar, so it will be available later on DFI's YouTube channel if you want to go back to it. There will be, after Julie and I have both spoken, there will be a Q&A. I would ask, if you think of questions as we're going, it's better to put them in the Q&A box than the chat box. Some people find the chats popping up really distracting during the talks. So if you use the Q&A box, we'll see the questions, but you won't distract anyone else. All right, I think that's everything for the admin at the beginning. So I'll go ahead and get started. All right. Okay, so yes, I'm going to do a quick talk around the state report for the UN CRPD and what the current process is. So what I'm going to cover is the reporting process around the UN CRPD, what's currently happening, what the consultation will be like, what the consultation is, and the Disability Participation and Consultation Network, which is a new network that DFI is a member of, and we're doing this webinar as a member of that particular network. So the reporting process. So as far as what is the reporting process around a human rights convention? So every state that ratifies any human rights convention from the UN must engage in the reporting process around that convention. This means the state must deliver regular reports to the committee that oversees that convention to inform them of the progress the state has made in implementing the convention. The committee takes these reports, as well as other reports it receives from human rights bodies and from civil society, and then it proceeds to examine the state. In the examination, the state is asked questions, both in writing and in person, and has to respond to these. After this process, after receiving all these reports, questioning the state, the committee will issue recommendations on what the state should work on over the next few years before they deliver their next report. So just some things to know about the reporting process. This process takes years to complete. It's not going to be a speedy process, and it's not going to resolve anything quickly. At the moment, the committee that oversees the UN CRPD is currently examining reports from 2016 and 2017. The process around this is very transparent. So it's a very transparent process. All documents that the UN receives related to the state will be put up online. And the questioning session where the state is brought in before the committee to be asked questions is broadcast live over the internet and recorded and can be retrieved later to be watched. This process depends really on the information provided by civil society at different points throughout the process. States obviously seek to present themselves in the best light possible. So for the committee to know what questions to ask and where the problems might be, they really do rely on civil society delivering that information. The recommendations the committee issues, which are called concluding observations, they're not laws. They don't have the force of a law, but they do provide a really useful document for advocacy to form for the next few years around whatever the UN has recommended. So as far as what's occurring right now, so Ireland ratified the UN CRPD in spring of 2018. And by doing so, Ireland committed to take part in this reporting process. So the first step is that 2 years after ratification, a state has to submit their initial report. So that would have been due in April of 2020 for Ireland. Obviously, the process has been delayed. It's not unusual for there to be delays. Looking through documents, I've seen states that delivered their first report 5 or 6 years afterwards. So Ireland's not particularly behind in this. The report is written by the state, but they must seek input from civil society on their report. So at the moment, the state has issued a draft report and is seeking input from civil society. After they've received that input, they will redraft the report and send it to the UN Committee on the Rights of Persons with Disabilities. So this is kind of a very simplified timeline of what happens. So you can see the UN CRPD is ratified. The state drafts its initial state report. The state puts the draft out to civil society for consultation. The state delivers the final report to the committee. Civil society delivers their shadow reports, and then the committee will examine Ireland. So we're currently at the stage where the state seeks input from civil society on the state report. So a lot of you will be familiar with the shadow report process. And just to explain how those are different. So as I said, the committee will collect several documents before it examines Ireland. These will include the state report, which is our current focus. The Irish Human Rights and Equality Commission will be expected to deliver a report, so they'll have that, and any shadow reports that civil society delivers. Now, shadow reports are written entirely by civil society. The state gets no input into what goes into them. It doesn't look at them before they go off. They are entirely written by members of civil society. Those are generally drafted after the state report has gone in, and they're drafted generally as a response to the state report, so they can respond to particular things found in the state report. So those will be delivered at a later stage. The state report is written by the state, but it must receive input from civil society. And that's sort of the first document the committee receives that starts off this whole process. So for why this process is important, this particular civil society feeding into the state report, having civil society read and look at the state report helps hold the state accountable for what they've said in the report. If there's anything in there that civil society feels is inaccurate or doesn't really represent the state of things in Ireland, that can be pointed out at this stage. It's also a chance to let the state know how people feel about the implementation process. If all the feedback they get is really negative, they'll know maybe things aren't going as well as they hoped. If they get positive feedback, they'll know those are things they're doing well. It's the first thing, our feedback into the report is the first thing that the committee will see from civil society, is what they've put into the state report. Obviously, later on, they'll get the shadow reports, which are a much more unfiltered view of civil society. But this is kind of the first step. So I've just pulled out a couple of examples of how other states have handled consultation. So this is from Australia. And here it's just a simple paragraph explaining how Australia handled their consultation with civil society. And it says, the Australian government acknowledges the key role played by non-governmental organizations in the implementation of the convention and consulted with them in developing the report. During initial preparations, 36 NGOs were invited to submit information for consideration in drafting its response to the list of issues. Following this, the Australian government made the first draft report available online, inviting comments from NGOs and members of the public. So that's a fairly typical kind of response. The state just reassures the government that the draft was put out for consultation and that they've redrafted it in response to that consultation. A more in-depth response comes from the UK. So the UK actually included a 5-page section on their consultation with civil society, which is unusual, but obviously completely doable. So this is just the first paragraph that explains how they did their consultation. And it says, during the preparation of the report, government engaged extensively with disabled people and their organizations to find out about what they thought about implementation of the convention in the UK. This included making the draft report available for public comment during a 10-week period between May and July 2011. A wide range of organizations listed below and 24 individuals responded. The 4 Equality and Human Rights Commissions that make up the UK Independent Monitoring and Reporting Mechanism also provided detailed comments on the report. And after that paragraph, it goes on for 5 pages, and the UK basically lists out all the themes, all the feedback in great detail that it got from civil society about the report. So there's a few ways it can be handled in the report, from a paragraph to a very detailed summary. And so we'll see how Ireland chooses to address the feedback that it gets. So as far as how you can contribute to this process, anyone can put in a submission. I will be sending this PowerPoint around after the presentation, so you'll have this link. But yeah, anyone can put a submission in, and there are various groups, and I'll talk about that more in a minute, who are also running consultations around the state report, and you may receive an invitation to one of those as well. But yeah, the deadline to put in a submission is the 9th of April, and submissions are accepted from anyone. There's no limit on who can write in to the government about the state report. So I also want to talk about the DPC network, the Disability Participation and Consultation Network. As I said, DFI is a member of this new network, and that's one reason we're holding this webinar right now. So the Disability Participation and Consultation Network is designed to promote the engagement of people with disabilities in the development of legislation and policies. So this has been set up because engagement with people with disabilities around government decision-making is required in the UN CRPD. It's part of the whole ethos of nothing about us without us. The government must consult people with disabilities around the decisions it's making to ensure that they're inclusive, decisions. The DPC network is funded by the Department of Children, Equality, Disability, Integration, and Youth. I think I got everything in there. But it functions as more of an independent body. It's not overseen, day-to-day operations are not overseen by the department. So as far as who is currently in the DPC network, there's a coordinating body, and that's Inclusion Ireland. There are funded members. These are organizations that are paid to take part in the DPC. That's ourselves, Mental Health Reform, SIM, and the DPO Coalition. In addition to them, there are about 70 or 80 plus non-funded members, people who have joined the network to be engaged in its work, but aren't paid for their engagement. There is a contact email if you have any questions about the network. As I said, I'll send this presentation around, so you'll have that link as well. So as far as what the DPC network does, it is a very new body, only really set up in January. So our first task is to assist with this consultation around the state report. And from there, long-term goals and plans are still being developed. But just wanted to make you aware that the network does exist, and this work is part of that network. All right, I think that's me. If you have any questions, I'm always available to contact. My email's in the presentation and also up on DFI's website. So I'll just stop sharing and I'll hand over now to Julie to talk about the Children's Rights Alliance's work around the Children's Rights Convention.
Great. Would you believe I almost left the meeting there by accident when I was trying to share my screen, so bear with me. Thank you very much for having me speak with you here today. I'm from an organisation called the Children's Rights Alliance, and my name is Julie Ahern, and I am the Legal and Policy Manager with the organisation. So before I begin, I'm just going to introduce you a little bit to the Children's Rights Alliance. I'm going to briefly talk to you about what the UN Convention on the Rights of the Child is, just so that you're aware of it. And then I'm going to talk to you about our experience in the reporting process, specifically focusing on the state report. And like Meredith, if you have any questions as we go through, pop them into the Q&A and I'll be happy to answer them afterwards. So first of all, for those of you who don't know the Children's Rights Alliance, we're an organisation, an umbrella organisation, and we have over 120 members working together to make Ireland one of the best places in the world to be a child. And DFI is one of our members, along with a load of other organisations working right across the area of children's lives. So we have organisations who work on the area of disability like DFI, like As I Am, Down Syndrome Ireland, Inclusion Ireland. But then we also then have a number of members who might work in local community groups on the ground, people who work in the area of health, or who might work in the area of youth participation. So we have quite a wide membership. And what we do is we all come together and try to bring the voices of children and young people along with solutions based on what are children's rights to the government. So we do this by identifying what the problems are, working with our members to develop the solutions. We also then educate and provide information on children's rights. And this is done through our Access to Justice project, where we provide free legal information and advice to children, young people and their families. And finally, we unite all of our members together and we campaign. So we often have different campaigns on different issues. The most recent one we have is on to get the schools reopened for children and young people. So that's just an overview of who we are. And as the Children's Rights Alliance, what we do is every time there is a state report due, a state reporting process due on the UN Convention on the Rights of the Child, we are the organisation in Ireland who coordinates the civil society response for that. So that was one of the reasons why we were initially set up in the first place 20-something years ago. And we have been through 4 reporting processes on the UN Convention on the Rights of the Child. Our last reporting process took place in 2016 and actually was a combined 4th and 5th process because the state took so long in submitting their state report that it was actually 10 years in the difference between the 3rd and then the 4th and the 5th, so they combined them. So what Meredith was saying about states often being delayed is commonplace. It's more of a rule than it is the exception. So for those of you who aren't aware of the UN Convention on the Rights of the Child, just very briefly, it was ratified by Ireland in 1992, and as I mentioned there, we've been examined in 98, 2006 and 2016. And interestingly enough, we have just started our process for examination in 2022, and I think we're about 6 months behind the UN CRPD in terms of that progressing. So we're really interested in not only sharing our learnings from the other processes with you, but also learning from you guys in terms of what you see as you go through your process a few months ahead of us. I'm not going to go into detail about what's in the UN CRC, but I'll leave it in the slides for anyone who's interested, and Meredith will make those available afterwards. But just so you know, it covers every area of a child's life. So similar to the UN CRPD, it is really broad, which can make the reporting process really interesting and sometimes a little bit unwieldy to manage. So this should be coming up, apologies. Sometimes technology gets the better of me. So I thought it'd be interesting just to put up a little diagram for you around what the process looks like for the state, just that you can see the difference between what they have to do and then as civil society, what we have to do. So Meredith talked about this a little bit earlier, but just in terms of the UN CRC, the UN Convention on the Rights of the Child, the committee first of all decides a list of issues. The state then responds to the list of issues. That's the LOI that I have there in shorthand. And this is in the form of the state report, and this is where you are currently at. And then for the state, the next step for them is to then send a delegation to Geneva, and then to get the concluding observations, which are the recommendations of the committee. So this is what the state has to do effectively. So I just wanted to show you the difference in terms of where the state inputs and then where civil society can input. So as you can see, it's a far busier diagram. And just to take you through it very quickly, so in terms of where the civil society, in terms of the Children's Convention can feed in, they can feed in prior to the issuing of the list of issues. So that's this one here. Then they can feed into the state report. That's this one here. There's also uniquely a children's report for the UN CRC. So this is where children and young people can bring their real life experiences to the committee. So it's a little bit different to the UN CRPD in this respect, because obviously the lived experiences will be brought in through the shadow reporting process and through the state reporting process. But because children are seen to be in a unique position, they have the opportunity to do their own children's report, and we would have coordinated that along with UNICEF in 2016, and we would have also coordinated the 2 before that. And then I have here the alternative report, so that's the shadow report. And this here is the piece that Meredith mentioned that will come next for you guys, and this is a really key piece of work in terms of how you get to bring your issues to the committee and to get them to understand what it is to be a person with a disability in Ireland and the issues that will come up for you, both good and negative. And as part of that, the Children's Rights Alliance would hold nationwide consultations. And the reason why we do this is to try to get a lot of different views and opinions. And then we'd also hold thematic consultations as well. So what happens next then is there's the pre-sessional hearing. So this is where the children and civil society get to go and talk to the committee. And at this point, it's really important for civil society to have a clear understanding of what it is they're looking for in the process, what their key asks are, and I'll talk about that a bit more in a moment. But after the committee have heard from civil society, they then examine the state a short while later. So at that point, they will have gotten input from civil society at the very beginning when they're deciding the list of issues. They would have gotten input from civil society in the state report, in their own report, and had a chance to have a talk with civil society to really eke out what the issues are. So as you can see, civil society actually more of a chance to input to the committee than anyone else does, which is really great. And in a moment, I'm going to talk you through some top tips that you can think about when you're engaging in all of these aspects. And then the final piece then is the state are examined. And when the state are being examined, what the Children's Rights Alliance does is it coordinates a group of its members and other stakeholders to go over for that as well. And the reason why we're there for that as well is that there's an opportunity to view the proceedings live in the room, but also to try to get the committee members to ask specific questions. So as you know yourselves, if a question is asked by someone that doesn't know what Ireland is like, only through these reports and through talking to people, and a minister stands up who's very well able to give a really convincing answer, but there might be no depth in it, or something might not quite be right in it. And civil society can often give a committee member or try to give a committee member another questions. They can maybe probe them a little bit more. So that is why we would often attend the examination of the state as well, so that we can be there to try to push our asks again. And it's another opportunity to engage with the committee. And then finally, the committee makes the recommendations to the state. And I'll talk a bit more in a moment about what to do after that, because we've had some experience that things that have worked really well. I hope I'm not talking too quickly, Meredith. I'm from Cork and I talk a mile a minute. So my top tips, and I thought it was easier to talk you through what to do in terms of where you're at now through top tips. So the state report consultation. So as Meredith said, this is one of your first opportunities to have your views heard and to feed into it. So what the state have done before in terms of the UN Convention on the Rights of the Child is they have held their consultation through the Children's Rights Alliance. So because we have such a broad membership, but also because we consult widely beyond our membership for the convention, we in 2013, in advance of the 2016 examination, sorry, all the dates are just might jumble people, apologies, but I hope you can keep up with me. So 3 years before they were going to be examined, they had written up their state report and they asked us to run a consultation for them. And what we did for this is we would have sent it out to our members and wider to stakeholders and gotten some written responses, but also would have held membership meetings and other consultation meetings. So there was many ways that people could actually engage in the process. Because often what we have found through these consultations is having people together to discuss items can actually help to really eke out the key core issues that are at play. Some of the big things to think about when you're doing your responses, and I would encourage as many people as possible to engage in responding to the state report, is that you don't have to respond to all of it. So that can be really daunting when you see it, because it can be quite long. Sometimes it can be quite dense. And you might think, okay, there's actually only 2 or 3 key issues here for me that I, as a person, really care about, or as an organization think are the big issues. I would suggest that even if there's only 2 or 3, that you still put in a response. And if you just focus on 2 or 3, that's fine. But what it does is it just makes sure that, as Meredith said, that the government get a good gauge of, are they on the mark or not? Because they will want to put their best foot forward. And you will have another opportunity in the state report, in the shadow report, sorry, to talk more about some of the issues within the state report. But it's good to try to engage constructively with the government and try to, get some of the answers at the beginning. And what we have found is that the importance of lived experiences, you cannot underestimate that. So bringing your own lived experience to the table is really, really important when you're responding to the state report consultation. The other thing I've done there is early engagement with the government. So every time Ireland has undergone the UN CRPD review process, so that's the Committee on the Rights of the Child review process, we have managed to secure some big ticket items. So the commitment to have the Ombudsman for Children's Office has come out of it. The commitment to end holding children in adult prisons has come out of it. So big ticket items that might not necessarily move here in Ireland because they mightn't be, on the agenda all the time, or they mightn't just be something that the government are particularly focused on. So what we do in the Children's Rights Alliance is develop our key asks as early on as we can. So top 2 or 3. This isn't the only things you're going to be looking for, but to just think, well, what are the big things that can have the biggest impact for your group of people? And for us, obviously, that's children and young people. So what we do is we develop our key asks, and at the very early stages, we engage with government. Because what the government often want to do is just before they go over to the Committee on the Rights of the Child, they want to announce some big ticket item of, aren't we great, we have just done this. So often you can get your change before the committee even examines the government on some aspects. Not all, and it won't happen every time, but it's a good chance to try and engage constructively with the government and to really try to give them a win that will make a big difference for people living in the state. So that's why I suggest early engagement with the government. So engaging in the state report, but also trying to meet with the people who are drafting the state report, as the DPC coalition, maybe going in and trying to meet with them, trying to bring to them 2 or 3 big ticket asks that you might have, and seeing if you can find a way to progress these, or even just to get their thinking around that. So I have down engage in a constructive dialogue. So when you are replying, be it as an individual or as an organisation, to the state report, it's good to be constructive. So we would always say it's good to acknowledge what's working well, and also then what could be improved. And we find that you kind of get more with the carrot than a stick, I think is the way the phrase goes. But you get more when you engage in a constructive manner with them. And it's well worth keeping that in mind as you go through it. And then also, I've talked about developing your key asks, but to develop an advocacy plan and mobilise members of your groups. So if there is something that 4 or 5 different organisations are going to be focusing on, then maybe consider coming together, having a quick chat, making sure that you're all going to be asking for in and around the same thing. It doesn't have to be identical, but basically that you're not contradicting each other. Because if there's contradictions, then you can find that things can just fall by, or some people might not be happy. So it's worth having a chat with each other, just making sure you're on a similar enough page as you go through it. But also something else that you can do is maybe decide that within the coalition that maybe 2 people will focus on one area, 2 organisations might focus on another, and that way then you're almost spreading your ability to engage in the process. And as I said, key is not only engaging in the written consultations, if that's what they go for, or the meetings, but actually seeking to meet the people who are working on it within the department. And often they're quite open to engaging with you constructively, sharing what their plans are, and then likewise sharing back with them what your plans are. Because in effect, there shouldn't be any surprises for the government in what you're coming back with. You're more likely to get more out of it when there isn't. So I'm just going to give you some top tips as you move forward past the state report, if that's helpful. And I won't dwell too long on these because I think we'll get more out of questions than answers. So again, I have refine your asks, make them clear and concise. So when you're doing your shadow report, you will have no doubt number of asks, probably running into 100, depending on how many issues are coming up. But refine your big ones. So know what you're going to be really pushing for. What do you want to see definitely within these concluding observations? What are the big ticket items? And focusing in on those and developing an advocacy plan, meeting with the relevant government departments, the relevant ministers, all of that is very important. Something else we have done is we've engaged with committee members. So often the committee members can be very interested in, well, obviously now the pandemic might make this a little bit more difficult, maybe coming to the country, meeting organisations, meeting people on the ground, just as more of a fact-finding mission than anything else. And we've seen great success with that, in that they can really get a flavour of what's happening on the ground. And this could potentially be done digitally, I don't know, but it's worth figuring it out. What's also really important when it comes to the committee members is mapping out who they are, what their areas of interest are, and where they're from. And by doing that, you'll often find that there are 1 or 2 there who are probably very aligned to what you might want, or who might have interests in areas that you're looking for. And it's worth making contact with them and engaging with them, and just making sure that they know that you're coming with all these issues. I also have down their engagement with other stakeholders. So really key bodies who are going to be submitting reports. So Meredith mentioned the Irish Human Rights and Equality Commission. For children, it's the Ombudsman for Children, but any other national human rights organisations that will be putting in a shadow report. But also what you'll find is that even though you have a coalition, you will have other organisations who'll put in a separate report as well, focusing maybe on a specific issue. And that can actually work really well. So an example of this with the children's report, with the UN CRPD, that's the Children's Convention, was in 2016, we would have coordinated as the Children's Rights Alliance the shadow report. And one of our members, Pavi Point, works on the ground with Traveller and Roma people in Ireland. So they would have fed into our shadow report, but then they also would have done their own their own report as well, as did the Immigrant Council of Ireland. And what was really good is that we had similar asks, but they were able to go into much more detail on those two particular areas. And all of it worked really well together to create a focus on two groups of people in Ireland who really needed that focus and to have really strong concluding recommendations. And we'd have worked really closely together to coordinate what we were doing and to engage with each other the whole way along the process. They would have travelled over with us and they would have been leading out on the advocacy in those areas. So it's really important that you engage with all stakeholders. I have there planned the pre-sessional hearing. So as I say, people tend to go, and that brings in what I just said about knowing who's going, bringing everyone together, having a chat about how everyone's going to approach it. May or may not happen now with lockdown, who knows, but whatever's going to happen with the pre-sessional hearing, bringing everyone together and planning. And then finally, before I finish up, I have a follow-up after the concluding observations, and which I meant to put in brackets, which are recommendations of the committee. And what we did in 2016 is we adopted what we call progress through partnership model. So we held the First Child Summit, and we held it in partnership with the Department of Children and Youth Affairs. So this was the first time that something like this happened after the concluding observations. We brought over two of the committee members who had delivered the concluding observations. And what this was the reason why we did this is to put a focus on trying to get these recommendations implemented. So like Meredith said, they're not legal binding recommendations, but they have really, really strong value for advocacy. So we would have brought over two committee members, and they remarked when they were there that this has never happened, that the state has done this in partnership. And we found the Department of Children and Youth Affairs really open to doing this and trying to figure out, well, how as civil society and government can we work together to really implement these recommendations. So it's worth thinking about in your planning. So that's all I'm going to talk to you about today. I have at the end of the slides just some of the things that are in the UN CRC for children with disabilities, because they might be of interest to people, but I'm happy to take any questions.
All right, look, we've got a few questions in now and a few comments as well. I might just skip over so a couple of comments from Damon Matthew Wise, talking about his work on the National Council of People with Disabilities. He mentions that when he worked with them and would go to the UN, he would make sure that the issues they raised came from people with disabilities or from DPOs, groups controlled and run by people with disabilities. And just as a mention, that is an important point for the UN CRPD, is that from the point of view of the committee that oversees the UN CRPD, the most important civil society groups are DPOs. And these are groups run by, set up by, staffed by people with disabilities. And the reason that these groups are seen as so important, it's similar to how there's a children's report for the Children's Convention. Children are in a unique position and they need to be given a special place to kind of put their voice forward. For DPOs, for people with disabilities have also often had their voice suppressed by society. And DPOs are seen as kind of the clearest voice. For instance, a service provider might put forward people who are most pleased with their service or might try to hide problems they're having, but a DPO won't. So yeah, that is an important point, that DPOs are seen as the best source of information from the committee. And so it's extra important that DPOs and people with disabilities do feed into this process. And this is Eddie Hennessy, really concerned about employment and self-employment being put together. There are two different pathways and supports can be different e.g. PA skill levels need to be looked at. And yeah, as Julie said, Eddie, if you have only one issue you're interested in the state report, you should absolutely still put in a submission on that one issue. So if you're concerned about how the state looks at employment, you can mention that you just want that part of the report re-looked at and explain why. So I'd really encourage you to just put in a submission on even that one issue by yourself to let people know, to let the state know why there's an issue with how they're looking at disability. So a couple of questions from Fiona Walsh. Fiona Walsh is for the Children's Rights Alliance. Fiona Walsh is concerned that the Children's Rights Alliance is aligned with the medical model of disability, and is in conflict with the requirement of the UN CRPD to move to the social and human rights model of disability, which would include moving away from the medical model in mental health. Julie, do you want to comment on that at all?
Yeah, and I'll take this with the other question that Fiona's put in, because I think that they're linked, about saying, will the Children's Rights Alliance hear the voices of children, parents and civil society around the alternatives to the medical model? Most definitely. I mean, we have a very wide membership. So as I mentioned, our membership does include St. Patrick's Mental Health Services, Inclusion Ireland, DFI, as I am. We have a very wide membership, mental health reform. So a lot of people actually on the coalition that Meredith was mentioning earlier. And yes, I mean, when we do our consultations, we are open to hearing from everyone. So we do regularly consult with children, young people, with parents, with civil society around the and especially around the alternatives to the medical model. I mean, in terms of the Children's Rights Convention, it doesn't promote a medicalised model of disability. What I will say is it was developed a long time before the UN CRPD. So what we have been doing since the UN CRPD is bringing the principles within that into our work. So just to say that to Fiona, we are definitely in favour of moving away from the medicalised model of disability as per the UN CRPD, and we're bringing that convention more into our work because it is more up to date, more relevant than the UNCRC was, because the UNCRC was developed in the 80s. So it did have a very particular lens when it came to disability. So instead what we're doing was taking the principles that they are now looking at in line with the UN CRPD and the UN CRPD into our work. So I hope that answers the question, but I'm also open to any further questions Fiona might have on that.
All right. And Jackie, I just saw your comment there that you couldn't see the questions. I didn't realize I hadn't turned that on. I hope the questions are now visible to all attendees. If not, I will copy and paste all of these and save them. So if anyone wants to see them, they can contact me and I'll let you see them. But I think I've turned on that all attendees can see all questions now. So question from Fiona and Jonathan. The process of deciding membership on the DPC network has not been transparent to me. Are there unfunded groups of members or just individuals? How many members are independent individuals and how many put forward by funded organizations? Were there limits on the number of people each funded organization could put forward on the committee? Could put forward? Do members represent the organizations that put them forward or just themselves? Does anyone represent people with disabilities who are not part of funded groups? What portion of the committee identifies as having lived experience of disability? So yeah, lots of questions, as he says. I can answer some of those. So anyone could, so when the DPC network was created, originally a call for tenders was put out for the funded members, so the coordinating members and the 4 funded members. And after that, people were asked to call one out for people to apply to be non-funded members. That call was open to anyone. I know some organizations, some service providers helped or encouraged their service users to apply. I know some people applied as reps for orgs and some people applied as individuals. It was open to all of those processes. There was no limit on who could apply, and there was no limit on how many people could apply from one org or whether you applied as an org representative or an individual. All of those things were allowed. Originally, there were only going to be, of the group that applied, the plan was to choose 20 representative individuals to join the network. The policy was changed and everyone who applied became a member instead because of the change in policy. So there was no, because of that, so you ask if anyone represents people with disabilities who are not part of the funded groups. Some individuals did apply. And that was allowed, and anyone who did apply became a member. I don't know what portion of the committee identifies as having lived experience disability. That's not a question I've asked. I'll send out, as I said, I'll send out my presentation, and it has a link where you can email the coordinating body for the committee. So I'd suggest that for more in-depth answers, you can email them, and they'll be able to feed back with much more detailed information than I have off the top of my head right now. All right, according to Jackie has said, so of the funded members of the coordinating body and the 4 funded members, only 2 are DPOs, and that's As I Am and the DPO Coalition. So Jackie's put that in chat, and yes, that is correct. So Gary Carney has asked, how proactive do you have to be, and how critical can you be? Gary, you can be in your submission, if you write a personal submission to the government, you may be as critical as you want. Nobody can stop you. You can write anything you like in that submission. As Julie said, when you're actually engaging face-to-face, it's better to be constructive and friendly, just because that's how you get, that's often how you get a cooperation from the government. But in a submission, yeah, you can say anything you like. As far as being proactive, again, I think Julie gave some really good advice on that, and I'm sure you can reiterate it. Being proactive, meeting with government, asking for meetings is a really important step. Julie, do you want to elaborate on proactiveness and criticalness?
I mean, on criticalness, it's completely up to you. If you think everything is to be criticized, well then criticize it and be as strong as you want. As Meredith said, we would always encourage, try to be a bit more constructive when you can. So if there is something that is worth saying it's grand or it's good or it's all right even, I would suggest doing that, just because it just can work quite well. In terms of proactiveness, I would suggest you be as proactive as possible. So really this process is what you make of it. So the more you see the organizations and the people who are more proactive have more of a chance of not only getting the recommendation, because that's only one part of the process. Really, you want this review process to make change. And if you're being as proactive as you can help not only get the recommendation, but actually get the change that you need at the end to make Ireland a better place for persons with disabilities. So I would say be as proactive as you can, and engage with departments, with the government ministers, with other organisations as well can be really key, and other stakeholders.
All right. So there's a couple more comments from Damien there on his work, but I think I've opened up the Q&A so everyone can see those. Just mentions, yeah, again, the importance of the social model versus the charity model and the medical model, which definitely, as Julie said, her convention, which is the only other UN convention that mentions disability, was written in the 80s and took a different view than the modern view. UN conventions are never updated. They're never redrafted. So basically, the committee and the people who work on them have to reinterpret them as time goes on to update to more modern views on things like a disability and mental health as time goes on. All right, are there any other? All right, Fiona just commented to thank Julie for her comments around CRA and the shadow report. Are there any other questions? Somebody, 2 seconds. Are there any other questions? No, all right. Well, in that case, I'm definitely contactable. I'm sure Julie can be contacted at Children's Rights Alliance if you think of any other questions for either of us. And as I said, this has all been recorded and it will be available up on YouTube for people to view again, to show to other people. So yeah, I want to thank you all for coming and thank Julie for speaking. Julie, do you have anything final you want to say, or? Best
of luck with the entire process. And if you have any questions or you need any other information, please don't hesitate to contact the Alliance at any point. We're happy to share our learnings.
All right. Yep. And I'd like to thank everyone for attending and asking questions. And yeah, we're hoping to continue this process all the way through to April when the consultation ends. So thanks to everyone and goodbye. Bye.